Hello, my name is Sharon Henry. I am the Administrative Director for Advocate Aurora at Home. I am joined by two Advocate Aurora Health physicians, Dr. Ezra Yates, Medical Director of our Post-Acute Network Skilled Nursing Facility Program, and by Dr. Robert Fitchenberg, a specialist in infectious disease. Thank you both for joining. We are here today to talk about two very important issues related to COVID-19. One of these is how COVID-19 is disproportionately affecting people in African American communities. The other topic is personal protective equipment, what we refer to as PPE, and how infection control and the use of PPE differ for hospital staff and for those of us providing care in patients' homes. So Dr. Yates, let's begin with you. Can you talk to us about the reason why COVID-19 is affecting African Americans more than other groups, and what can we as home care providers do to help reduce COVID-19 in this population?
Yes, hi Sharon. It has certainly become alarming at the significant impact that this COVID virus is having on our African American communities. I think there's many factors that weigh in here. One, there's chronic health conditions. We know that a lot of chronic health conditions, and I'm talking about hypertension, diabetes, chronic respiratory and heart disease, are more prevalent in our African American populations. And oftentimes they're not as well controlled. And there might be many factors that lead into that, such as access to health care, transportation, the cost of medicines, as well as access to healthy nutritional choices and exercise regimens. And we know that when you have a chronic health condition, particularly when it's poorly controlled, this is ripe ground for COVID virus. We know that people that get infected with COVID virus that have these types of issues often have more severe and often fatal outcomes. So that's a big factor there. I also think that there's some social economic factors that are concerning. I mean, we know right now that social distancing is our most important tool to fight this. And oftentimes in our communities, this is more complicated and difficult. Our African American communities tend to be a little more densely populated. They have sort of the multi-generational housing with people more congested. And also, a lot of African Americans don't have the luxury of being able to work from home. They have to go out because they work in the public sector. So I think that all of these factors, although COVID may be colorblind, all of these factors make our African American communities much more susceptible.
Dr. Yates, it's well known that COVID-19 has severely impacted our nation's skilled nursing facilities. As our SNF medical director, what can you tell us about steps we've taken to safeguard our patients and staff in these settings?
Yeah, sure. And so our PAN team, and as well as our SNF partners, have implemented a lot of things to try to keep not only the patients, but the staff safe. When we first started dealing with this, we first of all undertook a huge educational program to educate our PAN providers so they were well equipped with understanding this virus and what they needed to do to be able to provide care and to protect everyone. We also used to have providers that went to multiple sites or more than one provider in a site. So we eliminated that. So we just have one provider per site to minimize exposure. And even with that, we only go in to see a patient when it's absolutely necessary. We can't manage them otherwise. Outside of that, we've gone to virtual visits. So we're almost doing exclusive virtual visits on the majority of our patients. In addition, we're making sure that when our providers do have to go in, they have the appropriate PPE. The nursing homes, the facilities themselves have PPE, but like everybody struggling out there, it's limited and supplies run low. So we're providing our providers with their own set so if they get in a situation where it's not available, we make sure they're protected so when they go in, they can still provide care. We've also tried to optimize the transfer of care situation. So for example, if we're sending a patient from a skilled facility to the hospital, everybody along that pathway, the receiving end, the ambulance drivers, anybody involved is well aware of the patient, particularly when it's COVID suspicious and what they need to be prepared for. And likewise, if we're sending them home, we're trying to educate the families, as well as getting information from the hospitals when they're sending them to the facility so the facility can be prepared. And we're also monitoring the data. We're trying to keep track of who's positive and what's happening in our sites so we have a good overall idea of what's happening in the community. And likewise, our sites are doing their job too. No visitors allowed in any of our nursing facilities, and they're screening their employees on a regular basis with temperature monitoring, as well as we have several sites that have set up separate COVID units, like wings that just are housing our COVID positive or suspicious patients with the appropriate management, exclusive staff, et cetera. So those are a few of the things that we're doing to make sure that everyone stays safe out there and that we're still able to provide care to these patients. And I forgot to mention, you asked about the providers in the home health care setting. I think one of the important tools that they can provide to the patients in the home setting is education, how to appropriately disinfect their home settings, make sure they're cleaning doorknobs and light switches and things that are frequently touched, trying to give them that education, as well as making sure they're taking their medicines and reaching out to their healthcare providers if they don't feel well, and learning how to take their temps appropriately, things we may take for granted, but making sure that all of the people in the home setting are well equipped to do those types of things.
Thank you, Dr. Yates. Dr. Sinterberg, thank you so much for being here also. Can you talk to us about how our home health team members can be protected from COVID-19 while providing patients with good, safe care? And additionally, can you explain how hospital PPE is used on those COVID units versus hospital units and then post-acute care settings?
Thank you, Sharon, and I'm happy to answer those questions. First, I'd like to acknowledge the SNF program on the outstanding work they've done in responding to COVID-19. It's just really been a fantastic effort. First, it's important to know that Advocate Aurora Health and the post-acute division has put several strategies in place to keep our team members safe, as the safety of our team members, providers, and patients and visitors is our primary concern. Without people being able to deliver that care on the front line, it's really going to impact our patients. So we absolutely have to keep our team members healthy. Some of the strategies we've used include telephonic pre-screening of patients and household members prior to the visit, just to make sure that they're doing okay, to create PPE resource guidelines for the post-acute division, a COVID-19 EPIC banner, which also addresses discontinuation of isolation guidelines, cleaning guidelines of reusable equipment, and virtual visits as well, just to name a few. Talking about PPE in the home care setting, I'm sure it can be confusing to see some healthcare workers wearing N95 masks while others are not. And I'd like to clarify that with you today. Our PPE resource guide offers N95s or procedure masks for the acute care setting for COVID-19 units. Extended use or reuse of the N95 can be utilized only because they are more durable in an 8 to 12-hour shift while caring for all COVID-19 patients. This is a PPE conservation strategy and is offered by CDC, IDPH, and Wisconsin Department of Public Health. Now, our EDs, ED overflow tents, which are seeing all patients that symptom screen as positive, the URI ICC sites that see all patients that symptom screen positive, and ambulatory settings are all wearing procedure masks per the PPE resource guide. The exception is for aerosol generating procedures, and I'll talk about that in a second. In my own practice in the hospital, I wear N95 masks only where indicated for those specific procedures. For other patients, I'm wearing my procedure mask. So isolation regulations per the Illinois Department of Public Health and the Wisconsin Department of Public Health are droplet, contact, and eye protection. What does that mean? It means a procedure mask, gown, gloves, and eye protection, which can either be goggles or a face shield. An N95 mask is only required for aerosol generating procedures on presumed or confirmed COVID-19 patients. So some examples of aerosol generating procedures would include BiPAP or CPAP, high flow oxygen, tracheostomy, performing a procedure of tracheostomy care, nebulizer treatments, or CPR. And I suggest you follow your PPE resource guide for the post-acute division, as this aligns with the system PPE resource guide, which is based off of both State Department of health regulations. We are following these really to the letter. I should also point out that there was a video by our CEO, Jim Skogsberg, last week that in it he said that an N95 mask was to be used. Unfortunately, this was an error. Once the error was identified, the video was redone and corrected. And be sure to view this video again. Now, I know it's always scary when there's a new virus identified, especially when it becomes a pandemic like this, when there's so much fear. Everyone's afraid, and I understand that. But what we also know is that if we follow our PPE guidelines, we will keep ourselves safe. When I'm in the hospital and I am taking care of many COVID patients and I'm following appropriate PPE guidelines, I feel safe. And there's no reason why you shouldn't either. If there are any questions, refer back to the PPE resource guide. It will answer all your questions. And just also remember, your safety and your health is our top priority.
Thank you, Dr. Sincherberg. So on behalf of our division, I would like to thank Dr. Yates and Dr. Sincherberg for this important information. Their insights remind us how important you are in the fight against COVID-19. Thanks to all of you for what you do every day to take care of our patients. Remember, we are all in this together.